Hi guys, we are going to show you the alternative ways in which you can mobilize the shoulder that are not in the Kisner and Colby book. We're going to go over the inferior glide, anterior glide, and a posterior glide. When you're approaching your patient, make sure that you are giving them enough stability through their forearm and their elbow. That should be up against your side in a nice angle so that they feel cradled into that arm for yourself. You want to give a little bit of distraction. You also want to make sure that you're far enough away from their body, getting them into that open packed position where you're going to mobilize the joint. I make sure I understand where my bony landmarks are. I think about the clavicle coming up, the shoulder blade coming over into that acromion process. I know if I drop just off the acromion process, I'm going to be onto the humeral head. If you're having difficulty finding the humeral head off of that acromion process, I would imagine you're actually too close to the body. So make sure that you really are truly in that open packed position. So before you start, you're going to make sure your stabilizing hand is firm, but not strong. You're not gripping onto that humeral bone. So making sure that your patient is comfortable throughout the whole mobilization. As you come into that inferior glide, you're going to come just off of that acromion onto the humeral head, making sure that your glide is coming inferior down into the shoulder. I'd be doing a grade 3 on Dr. Kruchowski at this point, which would be indicated for increased range but also for some pain control. Okay, so if I'm now in an inferior glide, I can switch to the posterior glide that we discussed in class, thinking that I know that that labrum is a C shape as that humerus comes up. Really forms an oval, but as I'm thinking about just the top, it sits in there. And so you want to think about when you come in that you are still providing a little bit of distraction. You have to come off of the coracoid process, because if you're on that, you're really not making your patient feel much better. So coming into there, giving a little bit of distraction, even with the soft tissue, and you're coming into not just a straight down linear, but a little bit of a curve linear glide. So moving into that posterior glide. We're going to show you in class an alternative for the anterior glide. For now, another position just to stay where you're at is you can actually put your forefingers on the underside of your humerus. You're going to get your thumb around the top. Make sure that you don't press on the biceps tendon, and you're gliding the humerus anterior. Okay, as you can see on Dr. K, again, still a grade 3. Firm contact, but not strong. I'm not pointing with any of my surfaces of my fingers nor my thumb.